Assalamualaikum. Good evening to our respected and beloved Dr. Rizki. So, first of all, I would like to introduce our group member. The first is Nur Fatin Aini binti Walutfi, Siti Nur Syuhada binti Zulkifli, Nur Aina Jiha binti Muhammad Khair, and Nabiha Huaida binti Nur Fizan. So, we will present about the Minnesota Multifaceted Personality Inventory. So, I will present the introduction. The name of a psychological instrument that we choose in this research is Minnesota Multifaceted Personality Inventory, or we call it as MMPI. The test was developed by clinical psychologist named Stark Hathaway and neuropsychiatrist named Charlie McKinley. There were two faculty members at the University of Minnesota. The year of this test published in 1940, it was developed to assess mental health problems in psychiatric and medical setting, and it quickly became a standard personality instrument. The MMPI was the first truly effective psychological test, and it has ranked first in clinical psychology's use since around 1940. The Minnesota Multifaceted Personality Inventory is the most widely used psychometric test for assessing personality traits and psychopathology. This information can be used to draw conclusions about the test taker's psychopathy or to interpret psychological traits in comparison to the norm. The test is most used by providers to establish or re-evaluate care for an ambiguous clinical picture. Currently, the MMPI is commonly administered in one of two ways, which is MMPI-2 and MMPI-2-RF. MMPI-2 was published in 1989. The MMPI-2 is used in a variety of settings, including mental health, medical, and employment settings, while MMPI-2-RF stands for Multidimensional Personality Inventory 2 Restructure Form, was published in 2008, represents a fundamental shift in how we conceptualize and assess personality and psychopathology. So I would like to pass for the next presenter. Thank you.
The MMPI was designed by Hathaway and McKinley to replace the unreliable battery of interviews, observation and projective and self-report inventories previously utilized in medical setting. Using nearly 1,000 questions for diagnostic, interview and other self-report tools, Hathaway and McKinley developed 8 measures to assess mental disease across time. Hypochondriasis was one of the clinical scales. The MMPI clinical scale were expanded into the following year to include masculinity and femininity and social introversion. The clinical scale were created using empirical keying, which compare people's responses to questions to see what best distinguish two groups. The MMPI scale were developed by comparing patient response to those of Minnesota Normals, a group of hospital visitor and family member. The MMPI is a well-researched and widely used diagnostic tool used by mental health practitioners to assist in the diagnosis of mental health disorder and condition. It is a self-reporting instrument that assesses your level of functioning on 10 measures linked to various mental health conditions. The MMPI is composed of 10 clinical subscales that are derived from the way certain items on the test are answered: hypochondriasis, depression, hysteria, psychopathic deviant, masculinity and femininity, paranoia, psychasthenia, schizophrenia, hypomania, and social introversion are the sub-dimensions of the test that want to measure.
Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Nur Syuhada binti Zulkifli. So I will present about how many items in MMPI scale. So here we got three MMPI scale, which is MMPI-2, MMPI-2-RF, and MMPI-A. So for MMPI-2, we have from some research state that the MMPI-2 has 567 items, which takes 60 to 90 minutes to complete the test. Next is MMPI-2-RF. It have 338 items and take about 35 to 50 minutes to complete the test. Next is MMPI-A. For MMPIA, we have 478 items, and this test takes about an hour to complete. Okay, next, I will explain about the reliability value of the instrument. So, from a research from Hunsley et al. 1988 state that the reliability values for the instrument is range from 0.71 to 0.84, and the stability value range from 0.63 to 0.86. So these findings are based on thousands of adults in college, psychiatric, medical, drug and alcohol rehab centers, and also inmates. Okay, next is the MMPI test reliability is recorded as 0.50 to 0.80, where the principal scale hypochondriasis has the most elevated unwavering quality. This research is from Butcher 2010. Okay, next, I will explain about the validity skills. So what is validity skills, right? We need to understand first. First is validity skill can show how accurate the test is, as well as to what degree answer may have been distorted. So in this instrument, there's about 10 skill that used in this test. So I will explain a short summary for the skills, for the 10 skills. So first is the L skills. The L skills is also referred as to the life scale. This uncommon virtues validity scale was developed to detect attempts by individuals to present themselves in a favorable light. So people who score high on this scale deliberately try to present themselves in the most positive way possible and rejecting shortcomings or unfavorable characters. So next is the F scale. The F scales is used to detect attempts at over-reporting. Essentially, these people who score high on this scale are trying to appear worse than they really are. They may be in severe psychological distress, or they may be just randomly answering questions without paying attention to what the question says. Alright, next is the K scale. Sometimes referred to as the defensive skills, this skill is a more effective and less obvious way of detecting attempts to present oneself in the best possible way to underreporting. So people may underreport because they worried about being judged, or they may be minimizing their problem or denying that they have any problem at all. Next is the questions skill, also known as the cannot say skill. This validity skill assesses the number of items left unanswered. The MMPI manual recommends that any test with 30 or more unanswered questions should be declared invalid. Next is train skill. The true, responsive, inconsistent train skill was developed to detect people who use fixed responding, a method of taking the test without regard to the question, such as marking 10 questions true, the next 10 as false, and so on. Fixed responding could be used due to not being able to read or comprehend the test material well, or being defiant about having to take the test. This section consists of 20 paired questions that are the opposite of each other. Next is the VRIN skill. So what is the VRIN skill? The variable response inconsistency skill. This is another method to develop or to detect inconsistent random responses like fixed responding. This can be intentional, or it can be due to not understanding the material. So next is the FB skill. So this skill is designed to show changes, how a person responded in the first half of the test versus how they responded in the second half by using question that most normal respondent didn't support. So high score on this skill sometimes indicate that the respondents stopped paying attention and began answering question randomly. So next is the FP skill. This skill helps detect intentional over-reporting in pupil who have a mental health disorder, okay? So of some sort, or who were using random or fixed respondings. Next is the FBS skill. The symptom validity skill is used for people who are taking the test because they are claiming that they had a personal injury or disability. This skill can help establish the credibility of the test taker. So next is the S skill. So this is the last skill, which others name for this skill is superlative self-presentation skill. This skill was developed in 1995 to look for additional underreporting. It also has sub-skill that assess the test taker's belief in human goodness, serenity, contentment with life, patience, or denial or irritability, and denial of moral flaws. So that's all from me. Thank you.
Conclusion summarize. MMPIA evaluates the thoughts, emotions, attitudes, and behavioral traits that comprise personality. A person that takes MMPI or any psychological instruments may choose to deny or exaggerate the test available by behavior. So here, MMPI-2 is used. MMPI-2 assesses various elements of human mental health and behavior. 10 clinical skills will be used to examine 10 areas of abnormal behavior, as well as 4 validity scores to assist determine if answers are truthful, not be truthful, and how the individual thinks about the test-taking experience in general. In 2008, MMPI-2RF, the shorter test, was developed to address current concepts of psychopathology and personality, and it is not a replacement for MMPI-2. It is considered as more advanced form, so some have begun to employ this procedure instead of the earlier one with more incoming. From this article, I learned that this MMPI test cannot be online because it is considered an instrument that is protected. The MMPI is a protected psychological instrument, which indicates it can only be administered and interpreted by a psychologist who has been trained to do so. Besides, in the psychological test, mental health professions always use MMPI-2 to diagnose mental illness. MMPI and MMPI-2 does not differ significantly in terms of how the test is conducted, as well as its clinical or validity skills. There are no risks involved in taking the MMPI, so people can test it. However, it should be taken correctly to avoid an unnecessary negative label on people.